Question 111. A newly hired nurse labs medical center is assigned in the OR department. Which action demonstrates a break in sterile technique? A. Remaining 1 foot away from non-sterile areas. B. Placing sterile items on the sterile field. C. Avoiding the border of the sterile drape. D. Reaching 1 foot over the sterile field. Answer D. Reaching 1 foot over the sterile field. Explanation. Reaching over the sterile field while wearing sterile grab breaks sterile technique. While observing sterile technique, healthcare workers should remain 1 foot away from non-sterile areas while wearing sterile grab, place sterile items needed for the procedure on the sterile drape, and avoid coming in contact with the 1-inch border of the sterile drape. Question 112. Nurse Berta is facilitating a monthly mother's class at a small village. As a knowledgeable nurse, she must know that a mother who breastfeeds her child passes on which antibody through breast milk? A. IgA, B. Ig, E. C. Ig, G. D. IgM. Answer C. IgG. Explanation. The antibody IgG is passed to the child through the mother's breast milk during breastfeeding. IgA, IgE, and IgM are produced by the child's body after exposure to an antigen. Question 113. The clinical instructor asks her students the rationale for hand washing. The students are correct if they answered that hand washing is expected to remove A. Transient flora from the skin, B. Resident flora from the skin, C. All microorganisms from the skin, D. Media for bacterial growth. Answer A. Explanation. There are two types of normal flora, transient and resident. Transient flora are normal flora that a person picks up by coming in contact with objects or another person. You can remove this with hand washing. Resident flora live deep in skin layers where they live and multiply harmlessly. They are permanent inhabitants of the skin and cannot easily be removed with routine hand washing. Removing all microorganisms from the skin is not possible without damaging the skin tissues. To live and thrive in humans, microbes must be able to use in the body's precise balance of food, moisture, nutrients, electrolytes, pH, temperature, and light. Food, water, and soil that provide these conditions may serve as non-living reservoirs. Hand washing does little to make the skin uninhabitable for microorganisms, except perhaps briefly when an antiseptic agent is used for cleansing. Question 114. Which of the following instances requires the nurse to complete an occurrence report? A. Medication given 30 minutes after scheduled dose time. B. Patient's dentures lost after transfer. C. Worn electrical cord discovered on an IV infusion pump. D. Prescription without the route of administration. Answer B. Explanation. You would need to complete an occurrence report if you suspect your patient's personal items to be lost or stolen. A medication can be administered within a half hour of the administration time without an error in administration. Therefore, an occurrence report is not necessary. The worn electrical cord should be taken out of use and reported to the biomedical department. The nurse should seek clarification if the provider's order is missing information. An occurrence report is not necessary. Question 115. The nurse is orienting a new nurse to the unit and reviews source-oriented charting. Which statement by the nurse best describes source-oriented charting? Source-oriented charting. A. Separates the health records according to discipline. B. Organizes documentation around the patient's problems. C. Highlights the patient's concerns, problems, and strengths. D. Is designed to streamline documentation. Answer A. Explanation. In source-oriented charting, each discipline documents findings in a separately labeled section of the chart. Problem-oriented charting organizes notes around the patient's problems. Focus charting highlights the patient's concerns, problems, and strengths. Charting by exception is a unique charting system designed to streamline documentation. Question 116. When a nurse completes the patient's admission nursing database, the patient reports that he does not have any allergies. Which acceptable medical abbreviation can a nurse use to document this finding? A. NA, B. NDA, C. NKA, D. NPO. Answer C. NKA. Explanation. The nurse can use the medical abbreviation NKA, which means no known allergies, to document this finding. NA is an abbreviation for not applicable. NDA is an abbreviation for no known drug allergies. NPO is an abbreviation that means nothing by mouth. Question 117. The nurse is working on a unit that uses nursing assessment flow sheets. Which statement best describes this form of charting? Nursing assessment flow sheets. A. Are comprehensive charting forms that integrate assessments and nursing actions. B. Contain only graphic information such as INO, vital signs, and medical administration. C. Are used to record routine aspects of care. They do not contain assessment data. D. Contain vital data collected upon admission, which can be compared with newly collected data. Answer A. Explanation. Nursing assessment flow sheets are organized by body systems. The nurse checks the box corresponding to the current assessment findings. Nursing actions such as wound care, treatments, or IV fluid administration are also included. Graphic information such as vital signs, INO, and routine care may be found on graphic records. The admission form contains baseline information. Question 118. At the end of the shift, the nurse realizes that she forgot to document a dressing change that she performed for a patient. Which action should the nurse take? A. Complete an occurrence report before leaving. B. Do nothing. The next nurse will document it was done. C. Write the note of the dressing change into an earlier note. D. Make a late entry as an addition to the narrative notes. Answer D. Explanation. If the nurse fails to make an important entry while charting, she should make a late entry as an addition to the narrative notes. An occurrence report is not necessary in this case. If documentation is omitted, there is no legal verification that a procedure was performed. It is illegal to add to a chart entry that was previously documented. The nurse can only document care directly performed or observed. Therefore, the nurse on the incoming shift would not record the wound change as performed. Question 119. Patient Z asks Nurse Tony when an electronic health record system is being used, which response by the nurse indicates an understanding of the rationale for an EHR system. A. It includes organizational reports of unusual occurrences that are not part of the client's record. B. This type of system consists of combined documentation and daily care plans. C. It improves interdisciplinary collaboration that improves efficiency in procedures. D. This type of system tracks medication administration and uses over 24 hours. Answer C. Explanation. The EHR has several benefits for use, including improving interdisciplinary collaboration and making procedures more accurate and efficient. An occurrence report is an organizational record of an unusual occurrence or incident that is not a part of the client's record. Integrated plans of care are a combined charting and care plan format. A medication administration record (MAR) is used to document medications administered and their usage. Question 120. In the US, the first programs for training nurses were affiliated with A. the military, B. general hospitals, C. civil service, D. religious orders. Answer D. Explanation. When the Civil War broke out, the army used nurses who had already been trained in religious orders. Although the army did provide some training, it occurred later than in the religious orders. Although nurses were trained in hospitals, the training in the hospitals were affiliated with religious orders. Civil service was not mentioned in Chapter 1 and was not a factor in the early 80s. Nursing started with the religious orders. The Hindu faith was the first to write about nursing. In the US, all training for nurses was affiliated with religious orders until after the Civil War. Thank you for watching.